Hi, this is Scott McGann, health agent for the town of Falmouth, doing our weekly COVID update. Today is July 2nd. We're doing it on Thursday as opposed to Friday due to the 4th of July weekend. For information, detailed information, you can get it from our website at falmouthmass.us, which will give you links to the various sites and also to this presentation. Emails you would directly to us at health@falmouthma.gov, and our phone number at the health department is 508-495-7485. So this is our weekly update. As of March 1st, 202 cases, that's plus one from last week. Over 97% of all cases are no longer in isolation, about 98% if you take out long-term care, so between 97 and 98% are out of isolation. Falmouth has approximately 14% of the population, about 13% of the cases, so we're roughly where we would expect. And our peak was in earlier April when we were at 23%. The VNA, with the support of the health department, continue to do isolation and contact tracing on each case. That's going to continue indefinitely, and we need to jump on cases as they arise quickly so that they don't become super spreaders or things of that nature. As far as total new cases since the outbreak, you can see that we had one last week. We've been averaging around between less than 10, but somewhere around 5, give or take, since late, right around Memorial Day. We were averaging that 10 to 20 for about the month previous, with a big start of about 40 per week in late March, early April. So our trend has been good, and you can see that our counts have been about 5 or less for the most part. If you look at the total cases since the start, we're right around 200. We're at 202 today, 201 last week. You can see where we had a very big peak at the end of March, early April, another little peak in May due to some long-term care facility issues, outbreaks that occurred. And so, but we've been leveled off now for the better part of a month or so. This is the DPH's, Mass Department of Public Health's COVID dashboard. It's updated daily after 4 o'clock. So you can get new dates. If this happens to be yesterday's, it shows that the total number of cases were 261 with 28 deaths. Total cases 109,000 with 8,081 total deaths. Very important to look at our metrics of how we're doing, and the trends show that we've remained the same 3 green, which is the test rate's been low, hospitalizations have been down, our testing capacity is up, so those are all green. Yellow is in progress. Death rate is still at a yellow, and there's always a delay to deaths as the caseload goes down. Healthcare system readiness, we do have a few hospitals that are still at surge capacity at certain locations. We want to get that down, and some other metrics in there. And contact tracing capabilities, based on population, the CDC determines how many contact tracers, and the state's still working on that. Though at this point, I think, with the contact tracing collaborative at the state epidemiologist and the towns, right now for our caseload, we're fine, but we need to have at least the build-out capacity in the future in case we have another wave. As far as confirmed cases in terms of the swab test, so the test that when I've been doing this presentation now for probably 13 weeks or so, that the newly reported, we always dealt with molecular tests, so the swab test. And those tests were 157 yesterday. And so of the 200 and whatever, the 104 were probables or the antibody tests, where the 157 would be the molecular tests, and there's your death rate. Yesterday, I believe it was 70 cases with no deaths, and it's been fluctuating but staying well under 200 for molecular tests now for at least a week. So that trend is good. Here's our trends again. Remember, I tell you one of the big key metrics is that the testing rate, the percent positive, gets below 3%. We're currently below 2%. We have been below 2% since mid-June, June 18th. So we remain on a good track for that test rate. We want to get that as low as possible. It means we're testing really well. The COVID number of patients in the hospital has sort of flattened out around 750. It was 800 last week, so we're down a little bit, and hopefully that trend just continues. Surge capacity has been fluctuating between 4, 2, and 3. That's one of the things that we want to see it going in a downward trend. And the death rate has been in the 20s now since mid-June. And of course, we want to see that continue on a downward trend. By county, you can see that Barnstable County is at 1542. For the most part, it's been several cases a day, but not a lot in Barnstable County. It's been doing well. It's really flat. The one thing I did notice, if you look at the bottom green, it's Nantucket. Since people have gone to Nantucket for the summer, you can see a little uptick, and hopefully that as the population in Cape Cod and Falmouth in general, specifically rather, increases during the summer, hopefully that we don't see an increase. And that's what we have to make sure we do a good job contact tracing. And if the cases are from out of state or out of Falmouth, sharing these cases with other municipalities and other agencies and making sure that we stay on top of it. It's very important for us in the summer. If you look at the total residents isolated, we're down 807. Those are active cases that have been taken out of isolation and no longer active. We're down 807 from last Friday. So the trend shows that most of the cases were in the past and have resolved. All right, that's a good number of people getting out of isolation. If you look at our percent positive, our rate of which we're positive, the rate has been pretty steady at around 646 per 100,000. The state average is 1490 per 100,000, so we're about 2.3 times lower in Falmouth than we have in the state, and that number's been relatively consistent for some time now. Our testing rate's about a little slightly above state average, and our percent positivity is at 5%, where the state is at 12%. Hospitalizations are down 62 from last week, down to 760. Sorry, go back to that. So that trend has been downward for a while now. Our current cases in ICU are down 51 from June 26 to 123. And our current cases that are currently intubated, which means they're on the vent, are down 36 from June 26 to a total of 65. Long-term care facilities, the death rate is 5,127, which remains at 63% of all deaths in the state has been associated with long-term care. You can see that JML in Falmouth has had cases, Royal Nursing has had cases and some deaths. Royal McGann and Atria Woodbury Place have not had any deaths, but have some cases below 10. And that's, they're all doing well as of now, knock on wood. We haven't had any activity in a week or two there, and hopefully that continues. Hospitalizations in the county in general are down since early June. You can see that the counts were in the 5 and 6 range, with 3 deaths of those that are in the hospital. And then ICU beds were somewhere between 3 and 2. They were, as of the 30th, they were down to 0 in the ICU, with 5 and 2 people in the hospital, but not in the ICU. So the trend continues in a good direction. Healthcare, Cape Cod Healthcare does COVID testing. In Barnstable, it's still located at Cape Cod Community College, set up as a drive-through, but we'll be transitioning to the hospital campus later this summer. The hours Monday through Saturday, 9 to 5, and your physician will determine the need for a test and will schedule with the testing center by appointment. As of last week, June 24th, drive-through testing sites now located at the Falmouth Hospital. Both are both under the Cape Cod Healthcare, and Cape Cod Healthcare dedicated call center is 508-862-5595. So that can be done. If you don't have a physician that can help you, you can call that number. Maybe they can do some referrals. But that's the call center for Cape Cod Healthcare. There's also some COVID testing occurring at the East Falmouth CVS, I've been told. Walk-in clinics, some without a doctor's note, so like the Convenient MD down on Davis Straits as well. You can contact them. Also, you can go on the state's website, mass.gov/COVID-19 testing. And or you can call the health department, and we'll see what we see available as well. Just got a little screwed up. But the reopening phase 2, step 1 happened on June 8th. So we're getting out of the test, which all show that's in pretty good shape, over to the the phases of reopening. We started phase 2, step 1 back on June 8th, which allowed outdoor restaurant seating, some restricted retail access, lodging and short-term rentals were allowed, rec camps, sports fields, outdoor practices, semi-public and outdoor pools, all with guidance and restrictions. And then on June 22nd, we started with phase 2, step 2, which allowed indoor restaurant seating with 6 feet in between parties and other guidance. Personal care locations such as personal trainers, massage therapy, nail salons. Office spaces were increased from 25 to 50, and with the work from home whenever possible, and retail fitting rooms by appointment. So that's where we were at, and that's where we're currently at. Today, the governor spoke about noontime, and he's going to begin Phase 3 on July 6th with a 2-step schedule, similar like we did with Phase 2. Phase 3 will last a lot longer, according to the governor, and it will be done in a lot slower pace than Phase 1 and Phase 2 were done. So what's Step 1 sector-specific openings? Again, I don't have the guidance yet. That wasn't sent to us with specifics. However, taking notes off the governor's speech, this is what I've gotten. That gyms and fitness centers with 40% occupancy and face coverings will be allowed Monday. Museums, historical facilities with small guided tours. Pro sports without spectators. Some human service programs such as therapeutic day services, adult day services, some outpatient type of things. Indoor long-term care visitations and casinos were the few that I have come up with, according to what the governor was saying it during his speech. Gatherings, indoor max of 8 people per 1,000 square feet of space, up to 25. Outdoor max 25% of its permitted occupancy, up to 100 people in a single outdoor space. Also this week, New England, along with New Jersey and New York, no longer require a 14-day quarantine among the states, so you could travel freely without doing a 14-day quarantine among the New England, New York, and New Jersey states. Other states, you would still need to quarantine for 14 days. So Phase 3 is the new phase, and if you're part of Phase 3 openings, look at and you're a business owner or work for a particular business that's waiting to open, the guidance should be out, if you don't have it already, should be out shortly, and then just follow the guidance, and you can call the health department or email us with questions to help get you through it. One thing I want to say is Happy 4th of July. So over the past several months, we have been able to reduce COVID-19 infections substantially at both the state, county, and local levels. The reduction in case counts is a direct result of social distancing and face masking efforts of our citizens. As case counts are rising in other areas of the country, it remains critical that residents and visitors alike continue to be diligent in our efforts locally to maintain social distancing. So continued diligence, hand washing, staying home when ill, following the state guidance is still really important, even though our case counts are low. We are moving around. We're going away on vacation. People are coming here on vacation. We all need to continue to follow those, or we will or can easily have a blip or an increase at some point. So, the last thing we want to do is to undo the hard work that we've done. We've been able to start opening things up, and we don't want to have a hiccup. So, please enjoy your weekend, and everybody needs to stay safe. So, continue with the diligence is important. Again, as a recap, state metrics remain on a downward trajectory. Falmouth and the Cape cases remain low, very low last week. Phase 3, Step 1 begins on Monday, July 6th. So that's what I have for the week, and thank you.